Welcome to Breaking Down Mental Health with Dr. Jones. In these educational videos, Dr. Jones will discuss mental health diagnosis, clinical supervision, using technology in counseling, multiculturalism, and many other topics to help you get a healthy understanding of why mental health is important. Please don't forget to like, subscribe, and hit the notification button if you enjoy these videos. In this video, we want to look at the topic of practical applications when it comes to telemental health counseling. The importance of this video, it will help us look and see what are some of the everyday things that you need to know about when it comes to dealing with telemental health counseling. And so when we begin this video, we want to first start looking at professional counseling competencies. And these are some of the basic things that we need to know if we're going to practice professionally as a mental health professional when it comes to telemental health counseling. One of the first things we want to look at is this ability to express empathy. This is one of those things that we are taught in graduate school. We're taught about how important empathy is, how it's important for us to be able to step into the feet of our client, to be able to see what it feels like to be in those shoes and to respond from that place. And so that becomes a very important part of online therapy or telemental health counseling, because many times you are losing out on some of the body language, things of that nature. And so the ability to express empathy becomes a really important piece of this, especially if you're doing video-based counseling, to be able to connect with your clients. So knowing how to be a part of their lives, knowing how to be active in that process with them, knowing how to activate the empathy in the counseling session becomes something that's extremely important in this process, because we want that connection. We want to build rapport with that client. And if they can't feel that rapport being built, if they can't feel the connection between you and them being built, they're a lot less likely to connect with you, and you won't be able to get as far as you would like to with this counseling relationship. And so just the ability to express empathy is going to be a really big thing. Another thing we want to consider is the issues of transference and countertransference. And so transference is basically, for just the easiest way to understand it, is when your client, as they are working with you, they're seeing something in you that reminds them of something else. And so this may come across where some anger or other emotions may come out from that client because something about you or something you said, they have made a connection between those two things. So that could end up being an issue there. And so those issues of transference can come up in a counseling relationship. But also issues of countertransference, where we as a therapist or as a mental health professional, we may find ourselves in a place where we are seeing some connections with that client as well. And so transference and countertransference, neither one of these things are bad things. We just need to make sure that we are aware of them, especially as mental health professionals. So if we are seeing transference going on, we want to make sure we are able to approach it in a natural way to be able to help the client out as best we possibly can. But when we see countertransference going on, we want to make sure that we are talking to a supervisor or talking to someone else to make sure that we're being able to deal with that in the right manner. Another thing we want to look at is just fantasy. This ability to be able to live in a fantasy world with your clients. For many clients, especially some of your younger ones that you may end up working with through telemental health, being online and being connected to video, through a phone, or whatever the case may be, for them it's not as real as for them as it is real, but they might not consider it real in the way they end up working with you. And so just being able to have the ability to go with the client, go with the flow with the client as they're looking at fantasies of being part of their life. And so for many, I would say for many clients and also for many clinicians, this is a hard place to connect, because we have to be open to our clients' creativity that they may bring to the table. They have to be open to our creativity we bring to the table. And so this world of fantasy really becomes a big piece of the process of what we want to work on. And so just being able to be in the moment with them, to go with the flow, is a very important part of this process. Also, just looking at patients as well becomes a major issue when we look at this telemental health counseling. Patients for the process. Many individuals may not be used to doing online therapy. With COVID-19, we did see many people end up shifting to an online environment. But for some people, they just stopped going to counseling altogether. And so for them, being able to connect with a therapist, to be able to talk to them about their problems, and do it in an environment where there's online, or with everything going on online, patience may be something that we have to learn how to do, because this may be new to them. It may be new to some of us as well. So just understanding how important patience is in the role of us connecting with our clients again, because it's a learning process. We're going to have to learn some things about ourselves as we're working through this process. We're going to have to learn some things about our clients as we're working through this process. So just knowing how to be patient with the process is going to be extremely important. Also, some other technical competencies you want to consider is just a comfort with using internet tools when it comes to like downloading programs or various software. There are multiple software platforms out there now that allows you to be able to connect with your client, whether it's through phone, whether it's through text messaging, whether it's through video. And the issue with a lot of these programs is being able to be comfortable enough on how to use these programs with your clients so they know how to navigate this when they're trying to work with you. And so you want to make sure you've got some practice in with the software and knowing how to download it and use it first before you're engaging with your client. But the same thing with your client as well. It may be a thing where they need to do a trial run on how to download the software. There are many different software programs that are built into the cloud where your client does not have to download anything. But sometimes there could be some software issues where your clients simply don't know how to do that. So we just want to be prepared for that if that becomes the case. And so just that comfort with using internet tools is an extremely important part. Also, just basic computer skills with adjusting settings and configurations on your computer. This is going to be the same thing for your clients and for you as well. I'm a big Mac person. I only use Mac software, Mac computers. Some people are big with PCs, which is perfectly fine. But once again, knowing how to adjust the settings is going to be a very important part of this technical competencies that you're going to need. Knowing how to enable and disable cookies, things of that nature. Those are things that you will want to know how to do. Same thing for your clients as well as they're working with you, because there may be times where they need to know how to do that in order for the software to work correctly, and making sure that your computer is updated as best as possible. So all these things can come into play for you and your clients, and so you want to make sure that you're doing everything you can to be aware of that as you're working with them. Also, just this toleration of the need for swift responses to clients or delays in responses from clients. For many of you, as you know, I'm a big proponent of synchronous telemental health counseling, but you can do it asynchronously, and there's no problem with that. But even with regards to which methodology you end up using, many people, many clients sometimes are wanting a quick response back from you, which is a little bit different from when we're doing traditional in the office on ground counseling. Where if I meet with a client one particular day, it may be 3 or 4 days before I hear from them, or they may call and leave a voice message or something of that nature, and that may not be a problem. But if I'm involved in with counseling that's through text messaging or something like that, the client maybe want a very quick response from that aspect of it. So just making sure those boundaries have been set up on the front end is going to be very helpful for you and for the client. That way both of you can understand how quick there should be a response will be given and how quick you want them to respond to the messages you're sending to them. Also, just the ability to accumulate, store, and retrieve web links. The reason why this is becoming important, there is so much more great software that's out there now, great resources as well for our clients that's readily available on the internet. A lot of times clients don't know how to be able to get to this information. So I think it's just a good practice for us as mental health professionals to begin creating links and resource lists for our clients, and knowing how to be able to get that to them in a timely manner, in a way so we don't have to send anything through the mail. I want to be able to either email this to the person, you send it through a chat message, wherever the case may be. But the whole point of it is I want to be able to know how I can store resources for certain situations. So if I have a client who's dealing with depression and they're needing to they want some resources on some coping skills they can do when they're feeling depressed, you want to be able to have that information readily available. And so I always encourage people to create a list. That way they have this information readily available to give to their clients. Also, the ability to receive, store, and protect your communications from your clients. There may be times where your clients may want to send information to you about things that's going on with them. And so when you see that's going on, maybe you've sent an assessment out to them. You want to make sure you have a safe place to do that. I've realized for many individuals you are using electronic health records, and so it makes it a lot easier for you to send and receive paperless intake forms, paperless assessments, things of that nature. But not everyone has done that yet. And so if you're not in the place yet where you're using an electronic health record, or you're still holding on to using the paper and pencil method, which is perfectly fine, just make sure you have a place where you're able to store that information and protect the client's information as much as you possibly can. Also, when it comes to client screening, there's a few things we want to be knowledgeable about as well. Just testing the client's knowledge on some basic technical terms. When it comes to cookies, cookies is basically just a way for your computer to remember where how to get back to a website quicker, and it stores data there. And so sometimes people's computers need to have the cookies enabled for certain software, and so you need to know if your client knows how to do that, or if you're able to teach your client how to do that. And also, that's something that you need to be able to understand as well. So just understanding about cookies, understand what browsers work well. For most of the software that's out there now, they work on a lot of great browsers, but some software doesn't work great on certain browsers. So be aware of that and make sure your client understands how to be able to use certain browsers, or how to download a browser if they don't already have that browser available to them. Also, just having that conversation about encryption. I think as mental health professionals, we have a better understanding about encryption, but being able to explain that to a client is very important, so they can know that the information that we are sending and receiving to them is done in a safe manner. And so knowing how to explain that to your clients. And so this is something that we want to make sure as we're screening with our clients, that they are okay with understanding this terminology and know what you mean when you use those terms. And so many of them may not know these terms when you first start working with them, but the longer that you work with them, the easier this will become. But this is something that if you see them struggling with this from the beginning and for a long time, then maybe this may not be the best route for them. So this could be a good part of that client screening. Also looking at the type of internet service they have. It is still amazing to me that even today there is a large population in the United States who are still using dial-up because they're just in a rural area. You have clients who find themselves in situations where they don't have access to high-speed or fiber optic internet, and so because of that, that can limit what services you're able to provide to them. And so just being mindful of that. And even some people who do have high-speed internet, they may be limited, or there may be a cap put on by their company on how much data they can use during a certain time period. So we just want to make sure that we know what type of internet service our clients have and what they're using, and this will be very helpful for you in that whole process. Also, just looking at the presenting issues for your clients. There are some clients who may have had some history with suicidal or homicidal ideation, or they have acted upon that in the past. And so you want to make sure that this is something that you think about and look at as you're working with the client. Now, as I talk about suicidal ideology and homicidal ideology, I'm not saying that you cannot work with a client who has suicidal or homicidal ideology. I'm just saying you want to make sure you're screening for that, have a good understanding for that, know how long it's been since that's happened in the past. Those type of questions are some things I would make sure I know from the beginning, and that way it gives you an opportunity to make a great plan to know how to approach this as you're working with your clients. Also, just with different personality disorders, sometimes those can be a little bit troubling as you're working with clients. Once again, this doesn't mean it's impossible for you to work with clients. It just means that it may just be an extra hurdle for you to have to work through in this online environment. So just making sure this is an appropriate environment for them. And also just assess your comfort level of using technology in counseling in general. For many people, we have a lot of digital natives out there. These are younger people who have always had some type of technology in front of them since birth. And then we have people in our population who using a cell phone to text message somebody may be a very difficult thing for them because they're not used to that. And so we just need to be able to assess their comfort level of using technology in counseling. They don't have to be a computer whiz or anything to that nature, but they need to be comfortable using the software, because whatever software you decide to use with them, if they're comfortable using it, it's going to make your session a lot more effective. But if you're having a lot of issues with the software you're using, or the client's having trouble logging on, the calls are being dropped, or you're losing the internet service because your signal's not strong, things of that nature, all those things can end up becoming impediments towards your counseling, working with your clients there. So you want to be screening for that as you're looking with your clients. As you're preparing for that first session of the telemental health counseling, there's a few things you want to be looking at. Now I've talked about this a little bit already. Just practice with your software package first before using it with your clients. I cannot emphasize that enough. There's a lot of great software that is out there that you can use. Some of them are pretty easy to use, and some have a little bit of a learning curve, just depending on what you're used to using. So because of that, it's important to practice with a friend first before you use it with your client the first session. Make sure your clients know how to use it as well. But once again, this goes to being comfortable, and the more comfortable everybody is with the software, the easier it's going to be for you to connect with them in this environment. Also, just establish whether or not an initial face-to-face meeting is necessary to review the technology that we use in session. And so you may end up having to use a session where you meet face-to-face just so you can go over the technology to make sure they're comfortable using it. I've not been in a situation like that before, but I've heard of therapists where they have had that issue before. And so depending on the state that you're in, some states will require you to meet with them face-to-face for that first session. And then after that, you can go directly to using telemental health. But once again, you just want to make sure that they know how to be comfortable online with you as you're trying to connect with them. Also, just question the client about the current use and comfort with technology. I think that's important. If they're a digital native, this is not going to be an issue for them. But just trying to gauge how comfortable they are using the technology, and they will be free to tell you that, and that's going to help you to understand them a lot better, and also understand that this is a route to go with them. Also, just making sure that when you're in your counseling sessions, you are in a zone, and your client is in a zone where there's no distractions for either one of you. I've seen this been a problem for many individuals who practice online. I've seen situations where there's spouses or children or animals and all kind of things coming in, and they're part of the session, and it becomes a big distraction for the client. And so as a therapist, I'm going to make sure the zone that I'm in is going to be quiet. I'm going to be in a place where no one can hear me, so I'm probably going to use headphones, which is that's the next point there. But I'm going to be in a distraction-free zone so that there's nothing going on, and so I can get my attention fully to the client. But the expectation also is I want the same thing going on for my client as well. So one thing I'm going to do for my clients is I tell them, no, there's a few things I'm looking forward to as we're meeting together. I'm wanting you to be in a safe place and also a place without distraction. That means we can't do sessions while you're driving down the road. That's not a healthy thing for you. That's a lot of distraction. So I've had clients who try to do that before, and we had to cancel our appointments. So just get them in a distraction-free zone. So sometimes I've seen clients where they will sit in their car in the driveway and do the session from there because that's the only place they can go and be quiet, and that's perfectly fine. But overall, it's not really about the location. It's really about are we both in a place where we don't have distractions and we won't have anything that would take away from us being able to work together. Also, like I said, just using the headphones is strongly encouraged. I'm a big headphone geek. I love headphones. I have multiple pairs of headphones. And so find out what works for you. For many therapists, they like the in-ear headphones. That works well for them. Some people like the over-the-ear headphones. That's fine as well. But just find what works for you. But I would encourage you to use one, and I would also encourage my client to have some as well. And that would give it an extra layer of privacy while you're meeting with them. And the reality of it is you don't have to spend a lot of money on headphones, especially for your clients. And so if your clients will have a cheap pair of headphones, $5 to $10 earbuds they can use, you can something that for you will work as well. I think that's very helpful in that process. So that becomes a good thing. And also just setting your client verification protocol. It's important for us to know at each session or to where our client is. And so if I'm doing video-based session or text-based session or whatever the case may be, where is my client at the time of the appointment? And so what I want to do is I'm going to have some type of verification protocol so I can know where my client is. And so and also who my client is, because the reality is I want to know am I talking to the person I'm supposed to be talking to. And so one thing I will do for my protocol, I will make sure that during that first session my client will show me their ID, a picture ID of them, and that will help me to see that they are who they say they are. Another thing we'll do is we'll set up a passcode that we use at every session. And the purpose of this is so I know who they are. So for example, I may have someone whose password could be salt packet, could be their password. And so at the beginning of every session, I will ask them, what is your passcode? And they can say it's salt packet. And so we will use that each time. And so if I ever connect with them, or they decided to change venues when we're doing counseling and they want to do phone instead of video, and so it doesn't sound like them, one of the first things I'm going to do is ask, what is the verification code? And if they can't tell that to me, then we're not going to continue that session. So I just think, just for good practice, we're going to do that at each and every session, just so the clients know that you can verify that who your client is. But also on top of that, we want to make sure we verify where they are at the time of the appointment. Because one of the big things that comes up, and that comes up ethically with your clients, is knowing where they are at the time of the appointment, because they could be in a place where you're not licensed, and so they could be on vacation or out of town or something of that nature. And so you want to make sure that you know where they are, because what that does is it helps make a safety protocol for you. So if I know when I get on the video with my client, they always meet me in their kitchen, and I can see their kitchen, and I know that's the room they're always in. I know what area and location they're in. If there's ever a crisis, I know where to send somebody to. But if they come to and the session is done in a different area and I'm not used to seeing that place, I'm quickly going to try to find out where specifically they are. So in case there is a crisis, I know where to send people to. So just having a good client verification protocol is going to be healthy for you, and it's going to be beneficial for the client in the long run. Another thing we want to think about when we look at preparing for that first session of the telemental counseling is making sure that proper use of lighting is extremely important. So we want to make sure that whenever you are on your computer, that your light is behind the video camera on your computer. So when your light is in the front of the camera, you can see like on the left here, it looks like you're in witness protection. And so you can't really see who I am. The client can't see me, and the same thing can happen to clients doing that as well. And so on here on the right hand side, we see that the light is behind the camera. And so since the light sources come from behind the camera, you're able to see me very clearly. The client will be able to see me very clearly as well. So that helps out quite a bit. Also, just making sure the camera is at eye level. So if you use a desktop computer, it may be easier for you to be at eye level because a lot of computers, those computers are monitors up higher, and it helps out quite a bit. For some of you who use laptops quite a bit, you may have to use either a laptop stand or maybe put some books under your laptop. But the important part of it is making sure that you're at eye level with the client. I don't want to be too close into the screen, and I don't want to be too far back. And so making it something comfortable for the client, and it makes it look like you're making eye contact with them when we're doing that. And so that becomes very important to build that rapport and to make it as much as possible and comfortable for them in this counseling session. Next, we just want to talk a little bit about referrals. Just that referrals occur when the goals agreed upon by the counselor and the client have not been achieved. And so this is important for us to realize, because you may get a couple of sessions into doing telemental health counseling and realize this is not the best fit for the client. And so we've made some goals, we're trying to reach these goals, but telemental health counseling doesn't allow us to get to the place where we need to be. And so when I'm realizing that and I'm seeing that, then I'm gonna do everything I can to step away and find them someone that's going to be benefit to them. So remember, at the end of the day, this counseling process is about the client. And so I want to make sure they are comfortable. I want to make sure they are finding their place in this. And so when I'm doing that, I'm going to do everything I can to help them reach their goals, but sometimes I may not be the right person. And so if that is the case, then I'm going to refer them to somebody that can help them. And so just some reasons to refer your client is just the inability to assist your client. So if you're not able to assist your client, then that may just be a time where you realize that there's time for you to send them to somebody else, because you just may not be, it may not be your therapy, it just may be your therapeutic style, maybe your approach. It could be multiple reasons why. But you want to make sure, if you're not assisting the client, then you want to make sure you refer them to somebody else. Also, sometimes you might want to refer where they've got to a place where you've reached some of your goals, but they don't necessarily need counseling right now. Right now, they just maybe just need a good support system. So you've built a great support system for your client. They no longer need to be in counseling, and so now it's a good time for me to be able to refer them to that support system so they can get the connections they need there. And if they need to come back to me later on the road, that's great. But if not, that's fine as well. But I want to connect them with a support system outside of this counseling office. Also, when the counselor is no longer able to be effective in the counseling process. There have been times in my career, and I think all therapists in their career, where they make it to the point where they feel like they've done everything they can for the client, but the client just hasn't reached where they need to be. That's okay. There are some clients that we're not able to help as much as we think we can. And so maybe it's just time to pass off the baton and let someone else be able to do that. So it's just important to make sure that when we realize that we're not being effective, it's important for us to help out the client as much as we possibly can, and to engage with them. And then if we're not able to help them, send them to somebody that will be effective and that can help them out in that process. And also, when the client is relocating, there are times where clients relocate out of state or other places, and so those may be situations where I'm no longer able to see them anymore. And that's okay. That happens for all of us. And so when those situations happen, that's a good time for us to be able to refer. And so just knowing when to refer is an important thing for us to work on and to look at.